So I see the participants are coming in right now. It's 10, so we're going to get started. Thank you for everybody who's coming in to the second of our Healthy Buildings webinar series. Today we're going to be speaking all about sanitation and how to keep those high-touch surfaces as clean as possible, especially when there's traffic moving in and out of your building. There is a lot of unknowns and ambiguities, and we're hoping to be able to help everybody on the webinar and feel confident in the information out here and what best practices and procedures to put forward. So we're very thankful to have Tom Barczak from Forensic Analytics Consulting Services to speak with us today. He's an amazing person and an excellent expert in the field. So I can't say enough good things about him, but I'm going to let him introduce himself. Thank you for coming, Tom.
Great. Thank you, Jillian. Really appreciate the opportunity. And I also want to thank the Green Building Council for taking on this challenging topic. It is obviously rapidly changing, but it's a topic that we need to be discussing. It's a topic that we need good information out there and good response. So I appreciate you tackling this. Again, it's not an easy topic, but to put the webinars together and be proactive, I can't say enough. So greatly appreciate it for everyone. So we're going to get started. This is best practice gained from healthcare. I thought it'd be appropriate, but the purpose of the meeting today is really to encourage discussion amongst your team to properly address COVID-19 within your buildings, but also want to provide credible resources. That's also important as we tackle this. Again, the purpose is not to address and answer all of your questions. And hopefully you have a lot of questions, but it's to start a discussion amongst your teams, as this approach needs to be specific to your space, to your buildings, and to your team. That's why the discussion needs to start with you. I'm hoping to help start that discussion, give you some parameters around it. I'm also going to ask everyone to take out a piece of paper, pen, your Rocket book, or some sort of digital notepad. As questions may come up, you may have certain action items you want to take, and that way you can have easy access. Okay, the agenda. We're going to do a quick general overview of COVID-19, more so how it applies to our discussion today. We won't go into a lot of information, as I'm sure it's been saturated, but we want to discuss a little bit. I want to discuss why healthcare. It's an important topic. Then I've got 3 best practices I'd like to share. First one is know your building. Cleaning is now routine. That is critical. We'll discuss heavily of this new cleaning mindset. And creating the new norm. What's the new norm going to be as we move forward? And at the end, we'll have a time for questions. Okay, general overview of COVID-19. Okay, first we must understand that COVID-19 is a highly contagious disease. It's primarily spread through close contact with individuals who are infected. Now the CDC, and again, I'm referencing the CDC, it's very important to ask sources as we discuss this. But the CDC defines close contact as being within 6 feet of a person for more than 10 minutes. And that's without any type of PPE or other type of controls. We also want to touch base on surface transmissions. You know, it is suspected that as we touch surfaces and we touch our mouths, touch our porous's, that we could transfer the virus into us. And that is something we want to attack. So both person to person, and then also that surface transmission are going to be the main focus points. Now, the little caption in the upper right, you've seen that before in many newscasts, but that's the image we want to have in our mind as we're walking our building, as we're having this discussion of, okay, think of those droplets being sprayed. What do we need to do to help protect us and our buildings from that? Now, the good news, there's some general safe practices we must put in place. It's a good idea that we behave as if everyone has it. Now, it's critical we don't treat everybody as if they have it, but let's behave as if everybody has COVID-19. How would we react then? It's a great mindset, but again, it's not how we treat each other. We need to be very affectionate during this time and understanding. It's a big change in our environment. That leads right into modify our work environment and our interactions. This also applies to our home life too, and I'll touch base on that later. Personal hygiene. We ourselves own the first step of good personal hygiene, and that is going to be critical to our overall success in dealing with COVID-19. The second is social distancing. Now, my first 2 points there, notice I didn't mention face coverings, I didn't mention PPE, I mentioned personal hygiene and social distancing. I'm going to dive more into that during the presentation, why those are so critical. And then the other items are very beneficial, but not our first two action items. I want to talk about cleaning and disinfection. There's a process to this. It's not one or the other. It's cleaning, and then we move to disinfection. It's the process of doing both. These are great general safety practices. You also want to follow credible sources. I've got a few at the end I want to share. There's others one out there, but I want to talk about what is a credible source. How do you determine a credible source? And then follow safe practices in your personal life as well. What we do in our work, what we're exposed to in the work environment, we bring home, and vice versa. What we're exposed to in our home, we bring into the work environment. I have up there too the Kent County Health Department. They've done a great job. Your local health departments are a great first resource. Okay, moving on to hygiene. I cannot strive this enough or really drive this home. Hygiene is our best protection. It is essential. We want to wash and sanitize our hands frequently. And I asked the question, what is frequently? We hear that in the news quite a bit. What is frequently? Well, I've estimated minimum 10 times a day you should wash your hands. It's probably more likely 20 to 25 times a day you should be washing your hands. That's the new norm. We have to get used to frequently washing your hands. Personal items like keys. Who washes their keys? Not many people do, but that's an extension of our hands. So we need to think too, though, the things we touch are now extensions of our hands. Those need to be clean. Cover your coughs and sneezes. We know this, we've heard about this, this is not new, but we must get very, very conscious of covering our face. Even if we feel a sneeze coming on, covering and turning. I got asked the question of the day, well, what do I do if somebody sneezes, I'm within close to that 6 foot? Turn yourself. Turn yourself, you can also cover, you can move social distancing, you can exceed that. Take those precautions. And I'm gonna try very hard this entire presentation not to touch my face. It's one of those things we all do, but we can't do that anymore. We need to be very conscious of not touching our face, and I promise I'm gonna try very hard. Okay, I'm gonna talk about hand washing, hand sanitizing, and then that famous poster. If I didn't cover this, I would most likely lose my job being in the public health sector. But I wanna touch on a few things, hand washing. Thoroughly wet your hands. That's something that I'm not hearing a lot about. When you wet your hands, you're rinsing a lot of the proteins, a lot of the grime, the sources off your hands first. Then you apply soap to lather. We all know that the techniques, right? Getting the thumbs, getting the fingertips, but we want a good lather. So rinse first, then lather for about 20 seconds. You've heard sing happy birthday and different cues out there to help us. Then we also want to rinse our hands very thoroughly under running water, continuously running water. We'll touch base on the additional energy we're spending, additional chemicals, and additional paper products. We'll touch base on a little bit because this is the new norm. We're responding to a global pandemic. We got to make some leniencies here, not to forget what our goal is: lower energy, lower use, lower chemical use. But during this time, let's be aware we're dealing with a global pandemic. Got to make some changes, not to throw out the old ways, just adapt a little bit. And going back to dry your hands thoroughly. In the total time, 40 to 60 seconds, you should spend washing your hands. This is no more quick, you're out. So as I mentioned, if the minimum time is 10 times to frequently wash your hands, now we're doing 20, let's say, that's 20 minutes a day you're washing your hands. And that is a good practice. Then the overarching thing, don't touch door handles, not just for restrooms, but as you leave, be very conscious of what you're touching. Now, hand sanitizers. We must apply hand sanitizers after we have clean hands. We've washed clean our hands, now we apply the sanitizers. The reason is, can you imagine if you're working out in your garden, your hands are grimy and dirty, and you sprayed hand sanitizer and you're smearing your hands around, your hands aren't clean. Can you imagine the grit you're feeling? So that's the impression I want you to have, that understanding when you apply hand sanitizers to clean hands, to make sure your hands are clean. It's the same process to rubbing knuckles, make sure you rub to the dry, make sure the product is above 60% alcohol. But most importantly, follow the instructions of the hand sanitizer. Read labels. And again, as I mentioned, if I didn't show the famous poster, I'd probably lose my job. So here's the famous poster. But more importantly, this poster needs to be in all your facilities, all your hand washing sinks, your hand washing station. You want to show this poster. It's a good reminder for our general public. Okay, why healthcare? It's kind of a good question. You know, why we pick on healthcare, the best practices. So I want to answer that. In 1950, infectious control policies and practices, procedures started in healthcare. So they have 70 years of experience that we can pull from. It's a great resource for us. So if we have anybody on the call today that are healthcare leaders, providers, you work in that setting, they're a great resource for us. Find out, what are you doing? How do we get access to that information? There's a local group called MISHI. It's a Michigan Healthcare Society Engineers. Great local resource to aid in this discussion as well. The other thing about healthcare buildings, they're complex buildings that are engineered to treat patients, to work in, and allow the general public, visitors, all in that same space. They're complex buildings that are engineered. So it's a great information to have. They're designed to be clean and disinfected, hard surfaces versus porous surfaces. The other critical thing that I really want to drive home during this presentation is healthcare does typically, they do a great job with the team approach. They get the A for the A team, right? So when they have a project or an issue they want to face, they pull from various disciplines. They'll have an admin, an exec person, facilities. They'll have a healthcare, maybe infectious control. They also invite what they call EVS, environmental services, their cleaning team. So they approach things well-rounded. They also pull in outside consultants like myself, public health professionals, environmental consultants, mechanical, plumbing. They want to have a well-rounded team. And I think you are going to need that in order to face COVID-19 as we move forward. Also, I feel like healthcare lives the new normal. If you look at healthcare when you walk in, they're constantly cleaning. They don't do janitorial just at night like I think a lot of us do. You see cleaning carts throughout the day, throughout the spaces. It's kind of funny, but you look at their cafeterias. A lot of their cafeterias are one-way flow. You enter one direction, you flow through the cashier, then you have a sitting area. Now they're controlling that pattern. They can clean behind. I think it's, again, it's a minor thing, but something to look forward to. Okay, best practices, know your building. This is something that action items for you to take, and I think this is important. 4 action items. The first is identify your team. Well-rounded team who knows your buildings, who interact with your building and your team. You want to review your policies. That's step 2. What do you currently have in place? You should have basic cleaning policies, procedures. There should be something in place to address influenza. So now, are those sufficient for COVID-19? Are you using the right cleaning chemicals? You want to outline who's cleaning what space. My workstation, am I cleaning that, or is somebody cleaning that for me? I want to touch base on that a little bit later as well, but your review needs to be identifying this. What are your current practices? And that's a great place to start, is to review what are we doing now, and then you move into action item number 3, walk your buildings. You know your current plan, now walk your buildings, and this is important. And walk with the team. As you walk through your building, you want to identify your high-touch surfaces. Yeah, we all assume door handles, but walk through it and determine what is being touched. If you see any of those touchpads that are worn out, the numbers are worn out, that is a huge red flag. You also want to identify your traffic patterns. How do people enter your buildings? How do they exit? Both workers, do you have separate entrances for them? How do your customers enter and leave your buildings? You want to understand that traffic pattern. And identify your materials, soft surfaces versus hard. Do you have a lot of carpeting? Do you have a lot of floor tiles? Look at your furniture, your contents as well. Again, this is a team approach, and you want to write this down. You want to understand your mechanical systems, your engineering controls. If you have a manufacturing space, how do we separate the manufacturing from the office space? How do we clean? How do we separate those areas? Those are critical areas to have. I do always recommend take notes, take photos. It is a good idea to refer back to. So then I thought it'd be a good little exercise to look at different spaces and what I would point out, what I would suggest. Again, team approach. I'm not seeing everything, but just some highlights. Picture on the upper left, we have doorways, 2 sets of doorways. Maybe we make the one on the left an entrance, the one on the right an exit. Maybe we have proper signage to indicate that. Do I have to touch the door handles to get in and out? Something your team needs to answer those questions. The photo in the upper right, look at that furniture. Is it porous? Can it be cleaned easy? Do we have the right chemicals to clean that furniture? Do we need to separate that to create that 6-10 foot space? Do we need to remove some? What does that waiting area now look like with these new engineering controls? The photo to the lower left, that great conference room. you can't have 6 feet social distancing in that room. So your team needs to evaluate how many chairs need to be removed. Not leave in or put in the corner. Remove those chairs so that you can maintain that distance. This brings up another topic. In my office, I've got a little collaboration table. 3 of us can sit there and collaborate. That now is being removed. I'm not looking at using the large conference room that can fit 25 or 30 people. Well, that's an overkill, Tom. No, but I know in that space, I can have good social distancing. We can spread out. The photo lower right, this is maybe a different approach. We like open spaces. We like being invited in. But that desk and that space there, it creates a natural barrier between our workers and our customers and our guests coming in. So maybe having that natural barrier will help with that social distancing. I also like the hard surfaces in there. So as your teams are walking, identify, how do guests and customers come in? Do I have social barriers? Do I need to create those? And they don't have to be harsh. Let's not put caution tape everywhere, but maybe some ribbons. Maybe you've got decorative ribbons or natural countertops, tables you can bring in to, again, create that social distancing that we do need. All right, fourth and final action item. Prepare your response action plan, your RAP. This is Risk Assessment 101. You have now identified what are your cleaning policies, your procedures, what chemicals are you going to use? Are you properly staffed? Are you properly have the right equipment? You may look at changing surfaces, workstations, traffic patterns, adding barriers. Where are you going to put your hand washing stations? Now again, the team needs to decide not if, but where are we adding hand wash stations, PPE stations, signage? How do we properly communicate to ourselves, our team, our customers, our guests as they enter our buildings? The real question you want to answer in this fourth step is, how can we easily clean or clean easy? How do we control the environment? How do we isolate use? It's a little tough to say isolate use, but having that mindset, now we're approaching this appropriately. Okay, now we're going to talk about cleaning. Cleaning is routine now. If you have your janitorial service due at night, out of sight, out of mind, we need to change that mindset. I also feel like our workers, people in the building, ourselves, our guests, customers, if they see us cleaning, I think it's going to be reassuring to them. I think they're going to have a better sense of they're taking this seriously, they're taking the right precautions, they're taking an action responding to. All right, great news. COVID-19 on surfaces is relatively, yeah, I got to put that in, easily cleaned or killed, excuse me, it's easily killed. You have to use the right product at the right concentrations, and contact time is important, but it's easily killed. Great news. Okay, cleaning. Cleaning is the act of removing germs. Now, germs is a broad term. It's an organism that is disease causing or could cause disease. So I'm using that because these cleaning practices are not just for COVID-19. They should be effective for influenza and other infectious diseases that we're exposed to in our environments. So let's take a broad approach. We're cleaning germs, not just COVID-19. It's also effective for the other germs. But you first have to remove the dirt, the grime, the impurities from the surfaces. Cleaning does not kill the germ, but it removes it. That helps lower the spread, and that is critical. Good cleaning. If you're wiping, even with a Lysol wipe, and you're wiping a surface and there's dirt, there's grime on that surface, you are still in the cleaning mode. Keep going until that is clean. That's when you move into the disinfection. Using the right chemicals will kill the germs on surfaces. Disinfection does not remove that soil. Again, the two-step: clean, then disinfect. When you're cleaning, when you're doing this process, we do recommend you wear gloves, and the gloves are changed out on a regular basis. When you're cleaning, I do recommend before, but absolutely, when you're done cleaning, removing your gloves properly, you do hand hygiene. Immediately following, do hand hygiene after cleaning. And I've reiterated again, if the surface is dirty, you're still cleaning, you're not disinfecting. Now I want to talk about disinfection. You've got a great resource. Again, this is something that I would jot down. The EPA's got a great website listing all of these different registered cleaners. And if you notice, 21 pages. So you can first look at the cleaning chemicals you're using now. Are they on the registry? Are you using them appropriately? If not, you've got a great resource to go right to find that right chemical for you for your right surfaces. Now I'm going to stop for just a moment, just so everybody knows I've not mentioned face masks. I've not mentioned other PPE. I'm still talking about cleaning because, again, as a good reminder, this is our best practice. Clean, clean, clean. Okay, but as we are adding chemicals into our buildings, we have to be safe. If you haven't heard about MSDS, material safety data sheets, you need those. So every chemical you have in your space, have an MSDS handy. Have it so where people can gain access. Don't have it in the bottom drawer of the filing cabinet. Have your binder out. Have it easily accessible. Let people know where they're at. This is the time to follow instructions. I'm not the best at reading instructions, but we have to. Top to bottom, read everything, not just the safety. We want to talk about contact time. That'll be on there. Dilution ratios. That'll be on there. You must follow labels. Good old American glug method. More is better. Crazy chemist style. A little bit of this, a little bit of that. No more glug method. More is not better. If you look at bleach, very common, very effective. 9 parts water to 1 part bleach. Why? The chemistry and science behind that is it creates a loose ion, which attacks the cell membrane. More is not better. Appropriate ratio is critical during this time. Okay, clean and disinfecting, great conversation about it, but let's apply something. You've already identified high-touch surfaces. That's completed during your action item. Your teams walk the buildings. You identify these high-touch surfaces. You've identified the location. Now you want to talk about frequency, and this is something we use in my office, which is very helpful. So as you can see, we identify the high-touch surface, doorknobs. We make it a one risk because they're touched quite a bit. The cleaning process and what to use. We're going to use Lysol or Clorox wipes, and the frequency 3 times a day. We've identified that doorknob is being touched X amount of times, and we want to clean it after touching so many times or every time. That's up to your team. Now we got a checkbox to show I've completed that task. So this is something I want to incorporate with my buildings of saying, okay, I understand what to do, I understand the chemicals, but I need to know how to apply it. That checklist will help you. Let's talk about porous surfaces. Yes, they can be cleaned. Yes, there's chemicals out there to clean them. EPA's got some registered on that you want to look at. There's some evidence where steam cleaning, high temperature, again, steam, not hot water, steam as disinfection, could be a good option. I would lean towards maybe eliminating, maybe moving to hard surfaces. So just some ideas out there, but porous surfaces are a little bit tricky. Okay, let's talk about the new norm. The final step in this presentation. What is the new norm? We're now in a defensive strategy. It's a change. People used to come to our office. We like that collaboration coming into our spaces. But now we need to take the mindset, I've cleaned my space. I've taken control of my space. I'm going to put a ribbon across my door so people naturally know don't come into my space. It's been cleaned. We still need to have collaboration, but I'm defending my space now. It's much more a defense strategy. Or I've had people come in or maintain social distancing. I'm now going to clean that space right after that meeting, let's say. So much more in a defense mechanism. Pre-meeting planning. We have people coming in and out. We need to communicate clearly our guidelines, our practices, our policies before people arrive. Just encourage, be positive. Hey, when you do show up, we do have a 6-foot social distancing policy. We will have face masks available, or we will not bring your own. We have PPE gloves. We're maintaining and managing interactions by doing ABC. List those out. I love the team below all wearing face coverings as being proactive. Most areas are requiring in indoor spaces, we have face coverings. I know they're not maintaining social distancing, but you try and find a video or an image of a team. They're all together, so it's hard to find the image. But if you see this, let's spread people out. Let's encourage, hey, we need to spread apart. Next action item, again, for the new norm. Healthcare does a great job at this. They do what's called wash in, wash out. So when they walk into a patient, you've seen this. They wash their hands before they touch the patient. They treat the patient or even visit. Even if they didn't touch the patient, on the way out, they clean their hands again, sanitize their hands if they're already clean. The reason behind that is they don't want to bring anything into that space. They don't want to bring anything out. That is the new norm. As you go into a space, you want to clean your hands. As you leave, you want to clean your hands. This also applies to our home life. Again, this is one of those crossover. It's a good practice at home. Get into the habit. It takes multiple times, right, to create that habit. Now let's talk about cleaning hands. Let's talk about washing in, washing out. I got asked a question about, how do we reassure our people in our buildings, our team, having good SOPs. Let's be open on. Let's not make, again, these don't belong on the bottom shelf of the filing cabinet. These need to be out open, explained, simple, direct. It's going to help. Social distancing. Yeah, the new norm, collaboration now is spreading apart. The other interesting fact that we need to address is maximum occupancy program. This is a safety code basically designed how many people can we fit into a space that in the case of emergency, they can evacuate. You see these in buildings all throughout. I think my opinion is we need to reassign these, how many people can fit in that space so that we maintain social distancing. So there's a new number there. It's not maximum for evacuation, it's for social distancing. So you're gonna need to revisit those. The new norm, we have to have markers. I love these little dots. You've seen them in the stores that you've been in, if you've been out. We need to identify what is 6, what is 10 feet. It's not the normal for us. I saw that video where children are wearing large sticks or putting their arms out in helicopters to kind of get an understanding of what is the distance that we have. That's natural habit. You put a dot on the floor, people want to stand on. You put an arrow on the floor, they want to follow. So that's the new norm. Another photo I saw recently, they have these in an elevator. So think of your elevators. They are, how do you use social distance? Maybe there's 2 dots in that elevator that people can stand on. So now the elevator opens, both dots, somebody's on, I know the elevator's full. Door closes, I take the stairs and wait for the next one. Again, that's the new norm. We have to have that mindset. PPE, masks, gloves, they're part of the new norm. We need to have them available. We need to recognize, I love when people are decorating them. They're taking, their ownership of that, having a little fun with them. But we as leaders also need to model that behavior. We saw recently a situation where a great opportunity was had where a leader could have modeled good behavior, good face mask, good protection, and created the new norm. We need to model the good behavior. Mask, a lot of discussion. Again, the question, what mask, when should I wear the mask? My first response is, when's the last time you wash your hands? When's the last time you practice good hand hygiene, good cleaning? Okay, now we've cleaned our hands, we got that down. Now we talk about masks. Mask protects, again, those droplets as we breathe, talk, sneeze. We protect the droplets from projecting out. We're protecting others. It's our responsibility to protect others. Respirators help protect you. Now, respiratory protection, I'm not going to go into. There's great documents on OSHA and NIOSH, which regulate respiratory protection, the use, pulmonary protection for you, and how to create the proper seal. Great resources. Please lean on those credible resources. If you're using a respirator, it must be properly used. The last thing is, if you see anybody with their nose exposed and they're supposed to have it above, oh boy, this drives me crazy. Let's be aware of it. Let's give that person a little nudge. Let's give that, well, maybe not a physical nudge, but let's address the person, hey, your nose, you need to cover your nose. Let's give good reminders. It doesn't feel the best, but we need to give good reminders. Okay, and wrapping up, great references and resources. I'm not going to read this list. I'll make sure it's available. If anybody wants to contact me, I'm more than happy to share this. You notice CDC is on here. WHO. Cleveland Clinic has got a lot of great resources out there. Johns Hopkins, a lot of great resources out there to lean upon. Do not go to my Aunt Mary's Facebook page. Oh, that's not a credible source. You want to follow up with these sources. Go to these directly. EPA, WHO, OSHA. If somebody's quoting CDC, find it on the CDC site. Last, we've been reviewing this OSHA guidance on preparing workplaces for COVID-19. A great document, great summary. 2 things I want to point, 3 things actually. Page 18, talk about classifying worker exposure. We want all of our building workers, guests, to be in the lowest category, and it defines what that is. It's very helpful. Somebody who's not in contact, who PPE is a precautionary measure. We never want to be in the medium to high risk categories. We want low, and it identifies what that is. It gives a great little diagram to determine. OSHA is also offering a free on-site consultation. So as you put your teams together, lean on OSHA. I don't know their availability, but it's free. Why not pull that information in and have them be a part of your discussion? The one thing that I didn't find in this OSHA guideline, and there's not a lot of information out there, is how to apply, and I'll end on this, how to apply these practices to your space. They don't give a lot of practical advice. That's where you may need to consult outside, but you first need to start with your team. Your team knows your building better. On with that, stay safe at home and at work. Stay safe. Do appreciate you getting the time, Jillian, for this and for the invite. I appreciate the proactive approach you're taking on this difficult subject matter.
Thank you. Thank you so much, Tom. This is usually when we all would clap, but it's a little silent right now. There's a lot of information. Very much appreciated. Mike Workman also says, thanks, Tom. But so for anybody who's been on the call, you know that if you register a little earlier, we send out send your questions in advance, right? So I'm going to be doing a mix between the questions that were sent via email and also the ones that are popping up in the chat. So just so that the audience is aware. We'll first start from one of the questions that were sent earlier on, can you give us some tips on how to talk to our tenants in a way that assures them that we're taking all the best practices possible?
Yeah, I think, again, it goes back to the team approach and those SOPs, responding to, I think, ignorance, or it'd be ignorant not to have a response or to make some of these cleaning practices public or to show that we're responding to. So the first thing I always have good written policies and implement those, modeling the behaviors, next best thing of showing, hey, this matters to all of us. We're going to take this serious and we're going to protect everybody. We're going to think in the grander sense. So I think actions are critical and have it well documented. I go back to the team approach, Jillian. I just think that's the best. Hey, we got a team around this. It matters that much. That's very reassuring to me as I'm entering your buildings, that you have that you get the team approach and good guidelines.
So that you recommend communications maybe through newsletters or flyers on the doors, or?
Great science, great idea. Yes. Town hall meetings, if you have a larger group, maybe have it once a week or once a month, whatever your time periods, have that call, invite people to it. Hey, if you have questions about what we're doing, please join. We'll have updates. It's also a great time to take questions. You know, what questions do your tenants, your customers have? Get those questions to be able to answer them.
For sure, and it probably makes them feel a lot more heard too.
Great point.
Yeah, I love that. So a question that we had on the chat earlier, trying to scroll up to find it, was so in regards to disinfectant, what deep disinfection services are, and how should the building perform deep and disinfectant services offered by janitorial services? How frequently should they do this?
Yeah, so I struggle with the word deep. Just be very open. What's the difference between deep and standard cleaning? So thorough cleaning, and then move to disinfection are the appropriate steps. Cleaning a surface till there's no more soil, no more dirt being removed, and then applying appropriate disinfection. That is the process. This needs to be outlined and determined by your team. What is acceptable to your team? Now keep in mind the frequency is important. So if you have somebody who comes in who has, even on their hands, says the virus, of any virus, as soon as they touch that surface, it potentially could be contaminated. It's not a, hey, you get 20, 30 an hour of that surface being disinfected. Once somebody sneezes, a water droplet places on that or is touched, you've got cross-contamination. So really focus on that. A lot of people are opening their buildings by doing a deep clean. That needs to identify high-touch surfaces, what are the appropriate chemicals, and then execute that cleaning. That is the appropriate stage. Don't just go in and clean everything. Do not go in, and this is my personal recommendation, don't go in and fog that building and feel like you've got that reassurance, we're clean, we're fine. I'll touch on this real quick, Julie, if you don't mind, because I get this question often. Fogging is fogging is a method to apply a chemical to a surface. It does not replace cleaning, direct cleaning. Application of a product onto a surface is listed in the instructions or should be directed by your guidelines. How I apply it, how I remove it and clean that surface. Fogging has got a great impression. Oh, I feel great. You see all this white, but what is those chemicals? What are they doing? What's the long-term impact? It smells good. Well, that's not good enough during this time. So be appropriate of how you apply the chemical, how you clean. And that's really the proper steps. Open your building, flush your buildings too. That was mentioned in last week's webinar. I think Russ mentioned that, and I greatly appreciate hearing that. Run water, run your air, flush your buildings, clean your buildings, surfaces, high-touch surfaces. It's a great way of opening your building and reassuring that you're starting off well.
So what I'm hearing from you is that sometimes what would be considered like the janitorial night shift duties, some of those duties be incorporated into the daily, like maybe hourly, quarterly practices throughout the day as well.
Absolutely. This is now a time to be continually cleaning, not just janitorial services, our workstations, ourselves. And that's something where you need to determine who's going to do that cleaning. If you have a janitorial service, if you rely on them, now's the time to ask, what are your policies and procedures? What chemicals are you using? Is there anything that you need to do to add to their service throughout the day? Can they provide day service? Again, those are very specific to your buildings, but yes, should be incorporated in continually cleaning. If a doorknob's touched 100 times a day, when do you want to clean it? You want to clean it after 100 touches, 20 touches, after each touch? Again, that's where your team needs to determine how many times is that doorknob going to be cleaned.
Not only from preference, but also from practicality too, right?
You have to apply that, yeah. You can have somebody stationed at the doorknob cleaning it every minute. That's not practical.
Or do you see that people may have maybe the doorman open the door for instead of, so if one person's touching it for the traffic instead of everybody opening the door for themselves?
That's a great. A lot of doors that you can use the hip maneuver. They've got the arms now where you can pull with your arm to open it. And also you got the foot one. So maybe that's part of the team approach of maybe we need to install these. So we're not touching that doorknob. We've removed or reduced the number of times that doorknob is going to be touched, or that high touch surface. Again, if you have anything that's got worn down because it's been touched that often, red flag. How many of those ATM or those different touchpads that have worn out the numbers? Okay, we need a new method for that.
Yeah, I've seen that before too. I've been wondering that myself when I do my own grocery shopping or my grandma's grocery shopping.
Yep.
A question we have here: of the products on the CDC list approved for use in the electrostatic sprayers, is there that could lead to short or long-term damage to certain materials or surfaces?
Yes. That's something else we need to be critical. So it's applying the right chemical to the right surface. If you want to get in trouble, use bleach at your home as your regular cleaner and put dots and spots everywhere in your home. That'll get you in trouble. I know from personal experience. That's where, what's the surface that's touched? How do we clean it? What's the appropriate cleaning methods? There are some bleach type chemicals in bleach themselves that will remove the dye from fabric. You need to be very cautious of that. Steam clean, what chemicals. Also chemical residue. I don't want to get too far into this discussion, but we do leave residue behind. We also leave what's called disinfectant byproducts behind. So we want to be very cautious and aware of how we clean. But yeah, again, the fogging is not, in my opinion, the best application of a cleaning product. Could it be used in conjunction in certain areas? Absolutely.
And when you're talking about the byproduct that's left afterward, the residue, the chemical residue, and do you find there's a correlation between fogging and leaving chemical residue behind for people to be exposed to?
The tricky word to be exposed to, because there's a deactivation process as well. So I don't want to get there. You saw that long list of registered disinfectants, and they're all unique and different. And that's why, speaking of broad terms, it's a little bit difficult. But you want to ask those questions. What is the byproduct? How long would this be on the surface? What is the active ingredients? How long will they be active? These are great questions for your team. We ask you to make sure you're using the appropriate chemicals. The pros and cons list, okay?
For sure.
And that's where, what's the easiest way to clean this hard surface? Let's use this chemical, stick to it, have the safety instruction sheets on hand, and that's the appropriate measure. It may be actually reducing the number of chemicals we use versus adding to it. The other part too with that, yeah, it may be, hey, we're gonna pick two. We have a hard surface cleaner and we have a porous cleaner. Here's our two cleaning chemicals. We're gonna use that and that's it.
Yeah, yeah. There was a question earlier, like maybe like a fourth way through your presentation. And do you know if viruses live longer on porous surfaces or hard surfaces?
The jury is still out on that. So it basically depends on the host that the virus is in, like a water droplet. So there's a lot of host questions, a lot of biology that has to be determined to come up with that. So the general, they're saying, 1 to 6 days, you see a lot of that large gap because nobody's going to say a virus will die in X amount of time. I think the point they're trying to make there is harder to clean porous surfaces, and therefore there's a likelihood it's not going to be cleaned well, and the virus could live longer. So I think that's more addressing harder to clean than is the actual virus living longer.
Yeah, that was a good distinction. Thank you, Tom. Yeah. And another question that had come earlier, I think like 2 days ago, was that we all know that solutions degrade over time, and I think this might lead to the bleach question that was on the chat earlier. Solutions degrade over time, but how do you maintain sufficient biocidal activity in the chemicals that you have?
Yep. Boy, I keep harping this. So when you have your team together and you're looking at chemical, that is something, the activity time of that chemical, of that mix, the dilution, that be listed on the instructions. So that is important. When you're mixing chemicals in your MSDS sheets, every bottle needs to have a label with the instructions and safety on that label. So as I'm applying it, I can look at that bottle or whatever is in my hand and know safety precautions, how to use it, the appropriate uses for that. Poison control information is also critical. Again, safety on that bottle. So if you're mixing and then putting a chemical into a bottle, now that bottle has to have a label on it. And on that label, you should put the date it was mixed, and then good through that last date. If you can't fill that out, you need to get more information to put on that bottle. So it's the activity of my bottle, start date, end date. And so I know when I'm using it, oh, this is expired. I need to get a new mix for that. So that's how you're going to handle those timelines.
I guess a personal question, how do you properly dispose of chemicals that have expired that are in your stock?
Yeah, Kent County has got a great hazard material depot that you can take, and I don't have it, it's a couple times a week they're open, that they will, you call ahead, and they've got proper disposal techniques to the Kent County Health Department. Each county should have that, check with your county, but dispose properly through the county in the waste manifest. They have a great process and great resource information for you.
I assume every county has this too, for those who are not just in Kent County?
Correct. Yep, every county should. And if they don't have their own, if it's a small enough county, we'll have a resource for that. Proper disposal is critical.
For sure. And how can people find this information for their own county? On the website, perhaps?
Correct. Go to your public health, is to start there.
Yeah.
So go to your public health and then ask and start from there to go forward.
Thank you. I appreciate that. So to summarize a lot of the construction-oriented questions that had come through, you know that some construction will be, I guess, starting soon in Michigan. And there were some foremen who were curious about how to sanitize equipment, the variety of equipment they'll have as they're trying to move and pass, like ladders and drills and, other, what usually would be a communal resource between their whole team. Do you have any guidance on what they should do when construction begins again?
Yeah, and I'll give some general guidance. We did a recent protocol for a group of service technicians as they're going in and out of different people's residences. And we talked about tools. So tools can be very grimy. The first thing we suggest is wear disposable gloves. So that way, whatever you have in your hands, you're not necessarily, you could still be spreading through your hand-to-hand contact, but you're being protect yourselves. Easy to remove your gloves. Now you can wash your hands before, let's say, you break or go to lunch, before you start a new task. So that is a good tactic to employ. We do recommend that when you're done using a tool, that it be cleaned, especially if you're bringing it into a space and then taking it out of a space. So if you're taking it out of your service center, it's easy to wipe or to clean that, use it, and then when you put it back, to wipe and clean that. It may be a little redundant if it was just cleaned, I'm pulling it back out, but still you want to clean it as a habit forming measure. If you're working on a large construction, you're passing, again, the same ladder back and forth or climbing the same ladder, you're going to have some difficult challenges. Hand hygiene. Maybe you have a wall station at the bottom and then one at the top. Just trying to get some general ideas here, but it's a great discussion to have with your workers, with your teams. Okay, how are we going to address this ladder? How are we going to address this? We can't have 30 ladders, one for everybody to gain one floor, but how are we going to incorporate this? What are some measures we can take? Maybe our team identifies the ladders cleaned 5 times an hour, 2 times an hour, once an hour, once at every break. We're going to clean that ladder. So those are some, again, discussion points for addressing that.
Yeah, thank you. I guess like in an ideal world, I just imagine like a ladder being lowered into like a vat of bleach or something. Oh, good to go for the for the whole shift, but it's more nuanced than that, isn't it?
It is. Now that ladder has to be cleaned first before it's disinfected. So there's how do you clean? So the example was an old trusty hammer that's got proud years of grime on it. How do you clean it before you disinfect? That's a challenge that you're going to have to face.
It is pride too. My dad's a construction worker, and like everything worn is like all the sweat that went into it. That is love right there.
It is. It's pride. It's pride.
Absolutely.
Maybe the hammer's put on the shelf for now. Maybe a new, handle hammer's got a plastic handle that can easily clean. Maybe we use that for now. And then when we have a better handle of all this, we bring out the old wood-handled, trusty hammer at that point. Maybe, again, those are some discussions that should happen.
So the material being used is also something to keep into account too. Exactly. And it would be correlate with what sort of chemicals they'd be wanting to use from the CDC website that you had given earlier.
Correct. That is the resource.
Okay. And on the Q&A, the chat is going, and also there's a Q&A for the audience to be aware of. We have here from Sarah Kelly. I have heard the overuse of certain disinfectants can lead to antimicrobial resistance. Can you speak to that?
That is a great biological question. So we are struggling with seeing how do different organisms adapt to our cleaning chemicals and such. If you're concerned with that, the resource I would give you is contact an industrial hygienist, somebody who's familiar with your situation to address that. So it's very difficult for me to give a broad response to that. Are we seeing that? Absolutely. Is it a major issue? We're not necessarily seeing that right now. We've got a lot of good broad chemicals that handle a large array of organisms. So, but I would consult with an industrial hygienist to answer your specific question on that.
Coincidentally, a shameless plug, a couple webinars from now, we are having an industrial hygienist consultant come to speak too. So I hope that if you don't have one in your circle, that perhaps we can all consult the industrial hygienist who's coming soon.
Yep. In fact, we provide the same service. We'd love to be your resource as well to speak on those issues as needed.
It's great. The other question from the Q&A also is a bit long, so bear with me. But we're hearing about a new MAP1 or MAP-1 disinfectant out of Hong Kong that maintains antimicrobial properties on high-touch surfaces for months at low cost. Is this a product of a good solution for public venues?
We're seeing some of these chemicals that claim to have a long kill time, extended after cleaning. The short answer to this is use the CDC, the EPA's registered website. If it's on there, that is your go-to resource. Let's go through a credible source to get that information and to confirm that. I'm always a little leery about those claims, those marking claims. Are they effective? I asked the question before of, okay, long-term, if I'm an affected person, you just clean the surface, I put my hands on it. Well, wait a second. It's not guaranteed that surface is going to kill COVID-19. But you said it's long-lasting. So you start that discussion, slippery slope, and it doesn't give a good sense of credibility. It doesn't give a good sense to me that I'm being protected from that surface. So I think that's a slippery slope. But go to the EPA's website and verify on there.
That's the first thing I'm going to do when I get off this. I'm
Yeah.
curious about what's on that website. Um, another question too was, I guess the theme of these questions would be the toxic long-term effects versus like the short-term COVID risks. And do Green Seal and Ecologo are they good enough for COVID because have so many other good benefits with the rest of the building that they as a team like.
Yeah, it's I'm happy. I feel like I'm being. I don't want to keep giving the same response, but
Yeah, for sure, for sure.
but there's a great product called Benefact out there, and I have not checked this myself. But to go to the EPA's website and verify is Benefact on that list, that is where you start. So the question of the ecology and the different chemicals out there that we found to be great resources, how do we evaluate those? Go to the EPA's website, start there. Read the manufacturer's instructions and their MSDS sheets. That is where you're going to get the information to determine, is this an appropriate chemical to use on these surfaces? So again, I wish I could do it right now because I'm curious, Benefact, is it on the list or not? But that is the process that you need to go through all your chemicals. Would this be a good chemical to use? Oh, let me go to the EPA and verify, read the instructions.
Mm-hmm. Mm-hmm. I'm taking a look at the chat right now. Excuse me while I'm penning through here. But so in the case where people have high risk assets and they're trying to clean high touch surfaces, do you recommend that there is a more of a nuanced procedure with protecting high more valuable assets in high traffic areas, such as museums or venues of sorts?
Yeah, you and I talked about this briefly earlier too.
Yeah.
That is a very specific area. So if we fog a space, I think it's more to do with the application of chemicals as well. If we fog a space, yeah, we can't control where it goes. But if we have direct application to a cloth and then we're wiping high touch surfaces, that might be the best approach. We have high risk areas. Another area I'd fall back on healthcare. Not that they have museum areas, but they have high risk, very sensitive patients in areas. How do they direct their cleaning efforts in that difficult environment? What can we learn from healthcare? I think that's a great avenue to start. What I would suggest again is you have to have the right chemical for that. You have to understand byproducts. If you have a museum type quality, there's restoration companies out there, high level artistic restoration companies. I would lean on them. Another resource is called the IICRC, and it's a mouthful, I know that. It's the Institute of Inspection, Cleaning, Restoration Certifications. They have
awesome.
Yeah, IICRC. Contact me. It's a great website because they certify cleaning practices and policies. It's ANSI accredited as well. They have in their classes they teach and certifications for cleaning art after a fire, after a restoration event. I would lean on them to gain that information. A great resource.
That's very valuable. There was quite a few people coming from that regard of wanting to protect their buildings and the items in their building, but also protect the people who come to see the items. One last question, Miss?
Yeah, Julian, I don't mean to interrupt, but I just noticed that Page Construction has been using Benefact from the beginning because it's on the EPA list. So I appreciate that post because that's helpful because Benefact, it's on the list. It's a very well-known, very well-used product. So thank you for that feedback and letting me know it's on the list.
Awesome. And I think honestly, from what I've personally learned from this webinar, including the on last week too, was that myself included, many of us are looking for like the one add-in to the blueprint of our life to make us safe. And from both last webinar and this webinar, I'm hearing that yes, that's important, as well as there needs to be a personal cultural shift and habit changing too. You know, because there's not going to be like one magic wand item that's going to be saving us all. right. The last
Absolutely.
question from Kevin Summers is, are there any specific documents or guidance about cleaning and sanitizing fleet vehicles or vehicles with multiple occupants, like work vans?
Yeah. I don't know of any that are out there. I know I would lean on OSHA's guidelines, and
I was thinking
I
that
don't
too.
recall reading that, but I would lean on OSHA for that information and ask them how are they addressing these areas. It's the same thing. So when I talk about a work environment, we talk about the building settings. We talk about workers who are in fleet trucks. That's their work environment. That's their desk. So now it's the same process. Okay, what areas they touch within their desk? Well, steering column, shifter, turn signals, mirror, radio. Those are all the high touch surfaces that you need to identify. Now you talk about the frequency of cleaning. And that's how you address that work environment. It's not a, here's how we treat our fleets. No, here's a worker, that's their work environment. Here's the areas they touch. Here's the cleaning chemicals we're going to use. Here's the frequency. So that's the model that we want to have to address that work environment. That's another reason too why we have to have your individual teams. If you don't take anything away from this, please get your team together as soon as possible, because the executive person on that team might not know about the fleet or might not think about it because they don't deal with that section of your business. An admin person, facilities, you've got a maintenance person on your team. Now we're thinking the broad approach, and they can start asking the question, what about our fleets? Oh, great question. We need to address that workspace. But OSHA would be a great resource as well.
Yes, thank you. Thank you so much. Now that we're coming towards the end, I wanted to thank you one more time, Tom. Thank you for volunteering your time to speak with our members today about this very important issue. So just for everybody who is on the call right now, or the webinar, I guess I should say, that right after we're done with this webinar, there's going to be a survey that's going to come to you. And we'd like to know just basically two things. What did you think about this current one? And what more would you like to see? Because if there's something that you need to answer, we're going to go find the answer for it. Next one coming up is next week, which we'll be hearing from Ashray themselves. Excuse me. Ashray will be talking about what emerging technologies are being recommended and what, I guess you could say, building scenarios that you should keep your building at during this time for the optimal safety, as well as what recommendations that they've set down now and what that kind of looks like moving forward for codes changing in the future. That's going to be a really interesting one. We're really glad to have the local president-elect speaking on that. So make sure you register for that one coming up next week and fill out your survey, please. Thank you so much for everyone being here. We really appreciate your time, and hope to see you next week, everybody. Thank you, Tom.
Thank you very much. Have a great day.
Thank you. See ya.